Hello, Abraham. I just want to start off by saying how much I've enjoyed listening to you the last year, 2 years, I believe. My first question, actually, earlier was going to be about past lives, but I'll leave that for another time unless you want to address that. But listening to the people today, I'm a physician, family physician, and I feel we've taken a bit of a bashing.
You deserve it.
Thank you. It kind of turned my thinking all around as a physician, listening to you.
Oh, we're having fun with you.
I understand.
But you got to admit that you are sort of sickness-oriented.
Absolutely. Yes.
And you got to admit that when people come in, that's what you look for.
Exactly. And that's why I've tried to change my focus and to see people in their wellness, and I've felt you around me quite a bit when I've been doing your kind of teaching for patients who are willing.
And are you feeling them rise to your positive expectation?
Yes.
Tell others.
Yes. This is what I'm working on. One of the things that I need some clarity in is that, you talk about Jesus, and the healing that he did, that he saw people in their wellness. What I want to know is if you were in my physical shoes, in my office, seeing patients, how can I more effectively do that? I know I'm a healer. I want to be the best that I can, and I'd like to do a little shortcut by getting some words of wisdom.
Well, here is a process that would work very well for you. When you see someone who has steady, doesn't have to be fast, recovery from something, practice remembering that and hold it in a sort of vibrational data bank so that the next time a person comes with those symptoms or that diagnosis, you can overlay where they are with the progress that you just witnessed with another.
Okay.
So that your expectation about this, that, and the other is actively expecting recovery so that you are not dissuaded by the trauma of the current situation, but instead you're sustained by the memory of the improvement.
Okay.
So the first thing that you'll notice that will happen then is you will feel less concern about every situation because you will see it as the temporary anomaly that it is, no matter what it is.
Oh, I see.
So then you're this confident, even-energied being who looks full face at something unwanted and you don't flinch. Instead, you know the potential for wellness because you've been practicing it. You've kept that potential alive within you on this and this and this and this and this. If you don't have a broad enough patient base to give you personal exposure to these healings, look them up. Search for them because they're everywhere. Mm-hmm. The recovery on every subject that you think is going to pass through your doorway. And then with confidence, say to your patients, this is temporary, it'll be all right, and say it from your place of knowing. Okay. Because if you don't know it, you can say it, but they won't get it. You're going to notice amazing things happen because they, in their whatever condition they're having that's caused them to be there with you, have heightened desire for wellness. Mm-hmm. So their energy is focused in a pointed way. They're asking and Source is answering, and you're the soother that's going to help them let it in.
I see. Because that's the other question I had. You say if I'm vibrating at this level and they're down there, instead of dropping my level down, I bring them up. And I think that's one of my arts is to know the people that will hear the message and those that won't.
Well, some will and some won't, but you can't let those who won't upset you. And you don't have to give them the message as such. You just have to give them your optimistic approach, you see. Yes. And a lot of physicians are unwilling to do that because they call it false hope. Mm-hmm. And we say, if you're calling it false hope, then you don't have anything to give them anyway. It can't be false hope. It has to be real hope that you have activated because of your determination to study the cases that were real, you see. Yeah. And then you can say to them with conviction, I've seen this before. You can get over it.
Uh-huh. One of the tapes that I listened to a couple of weeks ago, the person who was taking, I presume it was thyroid medication, they didn't say so, they were taking a medication, and she was able to do without it, and you said that physicians, you say, you've got to take this pill for the rest of your life. And I thought, yeah, what about diabetics and insulin and medications like that?
Well, remember,
I got such an ingrained, sort of knowledge base that, this is true, you have to take this for the rest of your life. How do I get around that one? How do I work on that?
Don't try to buck that current, but here's what we would do. We would understand, and we think you've got that as a result of what we've talked about here today. Mm-hmm. See two concurrent journeys running. So there's the action journey and there's the emotional journey. So tell them to stay on the insulin. That's the action journey. Mm-hmm. But on the emotional journey, tell them it's going to be okay. And let them know that there's a possibility that their body will begin to regenerate it. We never encourage someone who's not ready to take the emotional journey into a place of manifestation to all of a sudden stop doing what it would be like somebody saying, I don't like my job, and us saying, well, then just quit. We would never say, stop your means of sustenance from flowing. We would say, continue to do what you're doing and try to make the best of it while you take an emotional journey that will bring you a better job. Yeah. So the same thing is true of this. Continue to follow whatever process is causing you stability while you work on your emotional journey. And really, we think that that is the greater role of the physician. They come to you because they believe that you know. Yeah. And the reason that we give physicians a hard time, and we do, is because most of them know more about illness than they do about wellness. Yes. And so when somebody comes to you because of what you know, you tend to activate detrimental things.
Okay. I see.
Yes.
Okay. I think that answers my question. Thank you very much.
Good time for a segment of refreshment.